about the human health effects of domestic pet ownership. I've known Dr. Carey for several years. He did his undergraduate at Western Kentucky University, and then he did his medical school as well as his residency at the University of Kentucky. He was one of the star residents. I may have been involved in some of his education. And then he was very successful there and became the program director for the Med Peds program and worked a lot on health disparities in some of our outpatient clinics. So we've been very lucky to get Dr. Carey here. And as you know, he's now the program director for the residency program. Without any more ado, I'll introduce Dr. Carey.
I thought when Dr. Lambiase asked me to do this, I would pick a topic that would be somewhat entertaining at 8 a.m. So another thing that I've always been interested in is low-hanging fruit of what could make patients have better outcomes and a better quality of life, especially those that have social determinants of health and different things that could impact their well-being. And that led me to research and kind of an understanding of what do pets do for us. So I thought today we could just discuss the reported health effects of pet ownership that would be available to patients that you treat, and we'll talk about from birth to death because every one of us comes in contact with people that have a sphere of influence around them. And then I thought we could just look at some medical literature regarding health effects of pet ownership and just animal interactions in healthcare settings, because a lot of us are rounding, especially in the children's hospital or in concerted efforts or in units where they have pet-assisted therapy that comes through. I have no disclosures, but I will admit that I might get distracted at some point, so we might have to put me back on target. If you look at the last 20 years, if you think about things that have come and gone, we've not really had a big issue with the pet industry being at risk. If you look at the American Pet Products Association, revenue on what we use for pets has only went up to where this year we're estimated to spend over $70 billion on pets, where in the mid-90s we were spending under $20 billion. And you'll see that pet stores don't really shutter as much. The malls did, but not so much bricks and mortar. And we tend to have a pretty robust amount of expenditures for them. Food always is the number one kind of thing, but then the vet care, medicines, and other services. And then you'll see some states that have discretionary taxes target veterinary services as a tax, and that's why, because they know that we'll take Fido to the vet and that they're almost as important as our significant others. And if you look at some European literature, some British people even think the dog is more important than the spouse. More dogs are owned as far as households than cats, but there's more cats per capita than dogs. That may be due to more kind of how many animals you can place in one setting and some different things, but the vet's the most expensive, and then food, and then things. What we don't see in this country is poor animal control to the point that you see risk of rabies and other zoonotic diseases like you see in other parts of the world. So pets are a cash business. How it affects health is we put money into these animals. They provide a livelihood. Many people that you interact with are either supported or have been supported by the pet industry in some way. So it's a significant part of the U.S. economy that's going to continue. The CDC does have resources for pets. They always will advertise those. This used to be a subset of an NIH website. Now it's part of the CDC website. Every spring there will be a national Healthy Pet, Healthy You Week. And if you needed a resource for patients and if you wanted to steer them, you could go to the Healthy Pets, Healthy People site at the CDC. It's been up and operational for some time, and I always use it as kind of a go-to spot for people that are looking to engage in pet ownership and want to know some of the purported benefits of it. They also have handy sheets that you can hand out to patients and families about what to do. The biggest thing that people need to do is if you bring something that with fur and teeth into your house, you should probably be respectful of instinctual drives of that animal. So if you have a toddler, picking Cujo may not be the best thing. So you have to pick the right pet, and then you have to be prepared for the finances and then the day-to-day operations of it, and then find a health professional for the animal as well as yourself. And then they do have videos that you can show patients when they come to the office. and then
While
some of
many
them are
people
really
like
cute.
pet reptiles,
Some of them
some
not.
are riskier than
but
others.
This is
Here's
what
what
it
you
kind of
need
looks
to
like.
know about tiny turtles.
We
Any
won't go
turtle
into
can
it,
carry
but you can
germs
kind
like
of see
salmonella
what you
that
can
can
give
make
for
people
patients.
sick. You can get salmonella from turtles by touching them, their tank water, or the areas they live and roam in.
Having problems.
You can't see germs like salmonella. Turtles can look healthy and
This is
clean,
where a
but
squirrel
still
thing comes
carry
in.
germs. Tiny turtles, which have shells
And
smaller
for
than
a
4 inches
number of
long, are especially
Years, it's
dangerous.
purported that pets and
Contact
people,
with tiny
if you own a
turtles has
pet,
been
especially a
linked to
dog,
several
that you
large
will have
outbreaks of
decreased blood
salmonella
pressure,
infection,
decreased cholesterol levels,
making more than
triglyceride
400 people
levels,
sick,
and help
mostly
you
young
with feelings of
kids.
loneliness.
If you buy a pet turtle,
provides
get it from a
increased
pet store you
opportunities for
trust.
physical activity
Only buy a
and
turtle with a
socialization.
shell
So
longer than
people
4 inches.
might be literal with that, but
Here's
what's the
how to
data
handle
behind
your
this?
pet
That's
turtle
always
safely.
kind of the question
Always
in
wash
mind.
your hands after handling
look
it
at
or
what
touching
affects
areas
us,
where it lives and roams.
If we can make a
especially
difference in
tank
heart
water.
disease, safety,
Don't bathe
and
it or
cancer,
clean its
then
tank
we
in your
might,
kitchen or bathroom.
affect a
Do
large
this outside.
proportion of
If
patients
you
that we
have
see.
to wash it
So
inside,
if we look at heart
use a
disease
tub or
and
bin that is
pets,
only used for
what do
your
we
pet.
see? You'll see
And
a lot of
whatever you
clinics.
do,
This is
don't
one out
kiss
of
or
New
snuggle
Orleans
your
that says
turtle.
pet owners have lower
If
risk
you
of heart
don't
disease
want
than
your turtle anymore,
non-pet owners. And why
don't
do they
just
say
toss
that?
it.
If you
Call
look
your
at studies
local
of
pet store
hypertension and
or
systemic blood
reptile
pressure,
rescue. Turtles
some, not
can be
all, have
great
found an
pets,
association
but
between
they
pet
aren't right
ownership
for
and lower
every
blood
family.
pressure. One
Families
such
that
study was an
include kids
Australian
younger
study
than
of
5,
5,741
adults over 65,
participants that
or those
attended a
with
free
weak
screening
immune
clinic,
systems
found
should
that pet owners
consider a
had
different
significantly
pet.
lower systolic blood
For more
pressures than non-pet
information,
owners,
visit
despite similar best
cdc.gov/healthypets.
body mass index and socioeconomic profile. So it seemed like in Australia that the pet provided something that the non-pet owner didn't have. If you look at a similar study of 1,179 subjects, pet owners were found to have lower systolic blood pressures, pulse pressures, and mean arterial pressures than non-owners, and a lower incidence of hypertension. But pet ownership was not associated with a lower blood pressure incidence of hypertension after you adjust for age and other co-founders. So there's different people that have different findings. But you will see that people pick up on these studies and they say that if you own a dog, you might have lower blood pressure. So you'll see a lot of marketing campaigns for that. The same thing happens when you look at lipids. There's not a whole lot of data there, and there's some cross-sectional studies in dog owners mainly that show that they have lower cholesterol levels and lower triglyceride levels. But when you get into the meat of it, we don't have lipoprotein levels, or we don't have HDL levels, or we don't have high-impact mortality levels that come into play. But as the dog says, as your bark goes up, so does your wolf. So there's some better studies that go up. When you look at some of the stuff on the internet, it'll say pets are better than ACE inhibitors when you look at blood pressure control or to mental stress. They do that because of this one study that was published in 2001. And this took 48 volunteers who were stockbrokers who had uncomplicated stage 2 hypertension. They were interested in stress reduction and agreed to acquire a pet. They completed baseline mental stress sessions, and then they were given either 20 milligrams of lisinopril and were reevaluated at 6 months with a second stress evaluation. And then this shows changes in systolic blood pressure, heart rate, diastolic blood pressure, and then plasma renin activity. And then you'll notice that there is a difference. The gray bars are people who acquired pets, so it's significant in the fact that their systolic blood pressure is lower, and their heart rate is lower, and their diastolic blood pressure. So the pet in this study did afford the ability to have a favorable response to mental stress than just the blood pressure intervention alone. So they kind of said presence of pets provided the kind of non-evaluative social support that is crucial to buffering physiological responses to stress, and that they suggest that there are higher cortical influences that can modify stress, and coping skills may be related to increased cortical inhibition of the brainstem. They don't advocate for substituting pets for human companionship, but they concluded that for persons who like animals and have few social contacts, pets can enhance isolated lives and provide health benefits. So a couple of things in that stick out. If you like pets, they're an alignment that's beneficial. and it's more of a companionship. So it's not just placing a pet in the home or having them around. It's an engaging relationship where both parties benefit and you feel some level of responsibility for care of the animal and you have a bond with them. Whereas there's other pet owners that just have the pet and they have their existence and the pet has theirs. We also know that we have a large issue, no pun intended, in both the pet world and the human world about obesity. This is some old data, but I think it holds true that, the majority of American adults are overweight or obese, but so are about a quarter of animals. So could we do something to combat the obesity epidemic in both humans and animals? If you look at, when I was in Kentucky, we always were close to West Virginia, so we were always like 48th in stuff or number 1 in stuff, lung cancer deaths or literacy rates. They would always say, thank you, West Virginia, thank you, Mississippi. So in Tennessee, we're good. We don't have fat dogs or cats, and we haven't got to the point where we're thanking West Virginia. But if you look at pet populations, what stands out, probably some inactivity or just kind of physical activity barriers that come into play. So what happens when you try to help people lose weight and keep the weight off? It's a support mechanism is one of the most powerful predictors of them adopting better habits and maintaining them. So if they already have a companionship bond with an animal, a lot of hypothesis would be that they would form a relationship with that animal. It would join in a support network, and then they could have healthy lifestyles. And you have seen videos where dogs come up to owners with leashes and say, let's go out for a walk and different things. So there is some kind of remodeling and operant conditioning that goes on with the dog in this. It's whether the human partakes in that and takes hold of it and makes time in their schedule. So we've seen some studies that have done this. Physical activity is higher in dog owners as compared to cat owners. That's come into play because when we talk about what the American Heart Association says about pet ownership, there is a difference between dogs and cats. But when you kind of look at, when you own a cat, you're not going around and seeing a lot of people putting a cat in a harness and walking it around. You do see some people put a cat in a stroller and walk it around. You see some people chase cats around the house. But you see most dog owners understanding the need for activity outside, and then they at least take the dog out to defecate or urinate, whereas a cat is self-contained in a confined setting. So dogs obviously have been purported for some time as having more physical activity, dog owners, than cat owners. When you look at the studies that say, if we put people and pets together and try to get them to exercise and incorporate a weight loss program, is the pet a novel approach? We know that it's easily done. A lot of people have pets. We said over 60 million households had a dog in it. There was over 80 million cats. So what could happen? So this is a study that was a 1-year prospective controlled trial that was conducted at the Wellness Institute at Northwestern Memorial Hospital. These were 21 to 65-year-olds who were overweight, generally in good health, and then they had to be concerned about their dog's weight and willing to participate in a weight loss program with their pet. So this study was unique in the fact that it wasn't just the overweight human, it was also the overweight animal. That could lead into some secondary gain as to why the person was increasing their physical activity, because they were worried about their dog's weight more than their own weight at some point. But the big thing that I always like about this study is if you had to participate in it, you met with a dietitian and your target caloric goal was approximately 1,400 calories a day. Now, a lot of sedentary inactive people ingest a lot more than 1,400 calories a day. And if we use a 2,000 calories per day recommended diet and you cut that by almost 40%, you're going to lose weight by just a calorie reduction, and then you couple that with activity, you're going to do something. And then they had to do 20 to 30 minutes of activity most days of the week. So that was usually more than 4 or 5 days. And then we collected height, weight, and physical activity measurements. And then you can see that what the breakdown is as far as the baseline weight, and what happened. The big thing that will stick out is that both groups lost weight and the pet didn't really partake. The humans with pets didn't partake any accelerated weight loss or anything compared to those people that do. But when you look at a study design, if you have active people and they have 1,400 calories a day, they're going to lose weight. But what this study showed was it was a way to engage a population into partaking in healthy lifestyles. Whether it was significant or not, that can be debated, but it was a target and it didn't achieve an outcome. It wasn't significant than just an outcome of physical activity and good diet choices. But when you had to convince people to partake in physical activity, it might be worth doing. So those were adults. Can you do it for the whole family? They replicated the study and they did the CPET trial. And they found that using pet dogs as the agent of lifestyle change in children and their parents is both feasible and acceptable, but it did not result in a significant increase in child physical activity. So it's a model, but it's not anything to write home about. There's probably some other baseline factors that increase physical activity and make it have increased longevity in changing people's behavior than just getting a pet and putting it in the home. So when you look at other cardiovascular disease risks, does just a dog or a cat around decrease your cardiovascular risks? This is a study that says living with companion animals, and again, this is an animal that has that bond. They looked at that physical activity and mortality in this country. And then it was one of those things to where it was a first, but a lot of these pet studies are a first. There's not a big voluminous amount of research. But they said that living with companion animals was not independently associated with better survival despite its positive association with baseline physical activity. So we know that people with pets probably have better physical activity rates, but their probably mortality is not greatly affected by it. But the dog does have a niche in the heart. If you look at the CAST trial, pet ownership, social support, and 1-year survival after acute MI, the cardiac arrhythmia suppression trial, they had a goal in mind. This is a subset of that trial, that they knew that pet ownership was an independent predictor of 1-year survival in a study of 92 patients admitted to a CCU unit. Excuse me. Prior to this study, additional research had reported that a pet being around was associated with decreased cardiovascular reactivity to stressors, and that got into the some of the other studies that came later, and that acquiring a pet lead to improved health status. So the CAST was much bigger than this. I randomly assigned subjects to be approached to participate in the study. At baseline, each of the participants completed the following indices: social support questionnaires, readjustment rating scales, attachment surveys, state trait anxiety inventory ratings, depression scale, an activity survey, and then an expression of anger scale. And then they collected mortality data and analyzed it. If you look, they did have a lot more white men, so it had some limitations in that. But what they found was people that had pets did have decreased mortality from it. Cats, dogs were the most significant finding they found. Cats insignificant. So they took away from this that maybe owning a dog was protective for your heart. So they made the statement that dog ownership made a significant positive contribution to the survival status while controlling for cat ownership, physiologic status, and other psychosocial factors, including social support. And this study provides a foundational basis for some of the recommendations that groups like the American Heart Association has used to support dog ownership and the risk and the decreased risk for cardiovascular disease. But it was just owning a dog. The cat didn't have anything to do with it. But they said that owning a cat is not harmful. They just said that there's probably other characteristics responsible for characteristics seen in cat owners as compared to dog owners. So do we have enough to write home about that dog ownership is protective to your heart? Well, the AHA thought so. So in 2013, they released a statement that said pet ownership, particularly dog ownership, is probably associated with decreased CVD risk. So they said probably, and they level of evidence it as a B. And then they said, pet adoption, rescue, or purchase should not be done for the primary risk of reducing CVD disease. But when they looked at the data available, it was probably associated with a decreased risk. Why do most people get animals? If you'll ask people, they want to make them part of the family. They want to have that companionship, that emotional support. So when you look at studies, do animals provide the emotional missing link? And if you look at some people with advanced disease states, you'll see a lot of people put play into the thought of companionship and what it does to endorphin levels and kind of positive reinforcement. I used to do a lot of HIV medicine in clinic, and then I would get a lot of people that wanted you to sign a letter for an emotional support animal and talk to their landlord. This one lady always brought in this dog in a bag, and I was like, you got to quit bringing in this dog in a bag jumping out at me. She was like, well, you took me off the methadone. I said, well, that's a different conversation. So I was like, I'll call the landlord. And then the other lady brought a bird on her shoulder the whole time, and I was like, you got to get that bird. It keeps cussing people out in the elevator. We got to do something about it. So eventually, and then I saw I, Tanya, and I had a moment of revelation that other people were like that, and it wasn't just me that had these patients. But when you look at kind of animals that are involved in support, you have service dogs, emotional support animals, and therapy dogs. So therapy dogs are the kind of dogs that you see in the hospital. They provide affection and comfort to individuals in settings, and you can be any breed, sex, dog. Usually they have to have behavior standards. There is one in the children's hospital that barks for his treat if you wait too long. The rest of them are pretty well controlled. A service dog, the big thing that I like to point out to people is it is protected under the Americans with Disabilities Act. So when you have protection under the ADA, you get a pretty good standing on where the dog is allowed to go and how it can facilitate a continued interaction with the human. The emotional support dogs, those are ones that would just provide comfort and support. And they are covered under the Fair Housing Amendments Act and the Air Carrier Access Act. So they can be allowed on planes, and then you have a legal standing with a housing authority or a landlord to provide for the dog or the cat or whatever animal to stay in the residence with the patient. Usually that's a to and from decision, and most housing authorities have forms that they can fill out, that you can fill out for patients. But emotional support dogs do exist. Patients aren't making it up. They're not specially trained. They're not covered under the ADA Act, so they can't go in restaurants, movie theaters, stuff like that. And they're not trained to assist just one person, and they don't have to be certified or registered like a service, like some of the aspects of service animals. So they do exist. You can use the National Dog Registry to help you do this. A lot of housing authorities have forms or processes that cover those, but you will see a fair amount of patients ask for your support for them to continue their companionship with an animal that they formed a bond with. And there is data to suggest that the breaking of that bond can cause a relapse in previous behaviors that are non-beneficial to their overall health state. There's been a large amount of literature that says there is this human companion animal bond, humans benefit, animals benefit. It's been in the nursing literature, it's been in the medical literature. And then you'll see that a lot of statements get made. Dogs are their primary focus. Pet owners are less likely to be lonely. Dogs were companions that provided unconditional love, reduced loneliness, and improved health status. And those are perceptive beliefs of patients. But as you guys have treated patients, I'm sure that you've concluded that if you can live in a perception to where they have a healthier state and then they can provide more meaningful existence, then they have a better outcome. If you look at some diagnoses, though, is it a big deal to have a dog? So this is a study in the late 90s about AIDS patients, and then did pet ownership have a big benefit? So at that point in time, and I think it's still true to some degree, depressive symptoms appear to rise in HIV-infected persons prior to AIDS development, and they're commonly reported by end-stage HIV patients who go on to develop AIDS or who are nonconformist to treatment or have other outcomes that are undesirable. And that if you have depression, it can have a vicious cycle that affects the immune system as well. And that they had thought that they had seen literature before that pets provided psychological benefits for HIV patients, and that it helped them combat feelings of isolation and loneliness. When you looked at it, a lot of people with HIV already owned a pet, and then cats and dogs were the big players. And then a lot of them at this point in time were this 35 to 44-year-old age group. But when you looked at the data, pet ownership was not supported as a benefit to depression. And you'll see that in other data too. So just having a dog, when you look at some of these things, is not going to help the AIDS patient, the cancer patient necessarily. It has to be individualized to that set of standards for that individual patient a lot of times. But if you look at all these studies, they're always going to have this statement like at the end of this slide: more important than the type of pet was the strength of the affective bond between owner and companion animal. So that human-animal bond and its kind of strength and how it plays out is probably a better indicator than just the presence of any animal at any point in time. So we, at this hospital, have a big focus, especially in the children's hospital, about therapy dogs. And I know that the medicine residents in the wellness program work with animal-assisted interventions and how they can help both themselves and patients. So when you look at an animal-assisted intervention, it's any intervention that intentionally includes or incorporates animals as part of a therapeutic or ameliorative process. So it's not just hanging out with pets, though. It's a planned program where the individual participates with animals in a focused and purposeful way. So when they come in, they sound like, yes, I'll just bring the dog around, but the people that do that kind of are working with a skill set and some ideas in mind. These kids were treated by a bunch of quacks, literally. So we've seen animals used for a large time to help patients. So these are kids in polio units that got treated with the presence of ducks. And then we've seen this evolve to where we've seen equine-associated therapy and other things. So when you look at the lingo, you see animal-assisted education, animal-assisted activities, or animal-assisted therapy. And I just thought we would talk about a little bit about what each of those are. So an animal-assisted activity is just a social visit primarily. It does involve goal-directed activities designed to improve patients' quality of life through the use of a human-animal bond. So the opportunities there are motivation, recreation, and education to enhance someone's quality of life. It's not formalized as much as other aspects of animal-assisted interventions are. There's no treatment goals. And then usually the visit is spontaneous. So it's just the dog showing up, going into the room, kind of facilitating this interaction. If you look at animal-assisted therapy, you are utilizing the human-animal bond in goal-directed interventions. So that usually will involve some kind of credentialed worker, a therapist, working within a scope of practice that sets therapeutic goals and then establishes guidelines for interactions between the patient or client and the animal, and then there's an evaluation of progress that goes on. And then both the animal and the handler should be trained, screened, and meet specific criteria to facilitate outcomes in the program. And it's used as an adjunctive therapy. So those get into a couple of the things that go into it. The human-animal bond, when you try to understand that, is an ongoing relationship that has bidirectional benefits, and it's central and important relationship to both parties. And it's a deeper attachment, whereas just an interaction is a short-term, situational, sporadic thing that's formed rapidly and easily terminated. You pet the dog, you get a good feeling, you move on with life. Not as enduring as that of the animal handler, pet owner. So when you think about the bond and companionship, you're really getting into this bidirectional benefit. So when you look at some of these studies and some of these outcomes, not so much what the data is pulling out about their systolic blood pressure or their lipid levels, you're seeing that there is this bidirectional flow and this kind of benefit from this companionship and this therapeutic bond. We've seen, things come into play over the years of when we've done this. Ancient Greeks documented that horse-assisted therapy can raise the spirits of the incurably ill. They also used Asclepian medicine and put snakes in temples for a spiritual reason, but we don't do that anymore. And then you will start to see equine therapy come into play in the 1700s and then go on to establish a pretty prominent foothold in certain things. You will also see that when you look at the literature, I just wanted you to know from a chemical basis that you do get an increased dopamine level, your endorphins go up, you combat some of the things that can help divert you into non-adaptive behavior. So there is a benefit. It comes at a chemical level. There is a large amount of evidence that say these interactions are helpful. You just have to be careful in how you use them in your therapeutic domain. Sometimes if a patient is not willing to accept the animal as being part of their treatment plan, I wouldn't probably force that on them. So there is one of those things to where you have to use your judgment in that. One of the settings we tend to think about animals a lot is cancer patients or palliative care. Previous studies that looked at, when this article was published, that nursing homes that have animals and plants around had medication cost decreases from about $4 to about $1 per patient per day. There was decreased stress, and they're most likely to better cope with stressful life events and suffer from loneliness and social isolation, that continued kind of thing you see play out. So Australia in 1991, a resident dog in a hospice setting improved patient and staff relations and overall morale. Sloan Kettering had something in the early 90s. The role of pets in young families dealing with cancer. It showed that companionship of pets help children adjust better to serious illness and the death of a parent, and children were more likely to confide in a pet than a person, and that the pet helped to maintain the daily structure, which is often fractured when these kids go into treatment groups and have these regimented lifestyles. So what I always tell people to do is don't assume that just because you work in a hospital or institution that the pets can't come in. You probably need to have a discussion with the powers that be, the nursing organization, and different things to know the animal policy of the institution. And then a lot of them will embrace animal volunteer programs. They just do it under a confined set of guidelines. And then companion animals, especially an animal that has formed a bond with a patient, so the patient that already has a companion animal can help you facilitate end-of-life communication, grief counseling, and review of that by bringing that animal with that bond in to play on some of those things, not just the random therapy dog. If you look at one of these kind of neat studies, I always kind of went to restaurants and wondered why they had fish tanks placed around. So if you look at this study, it's animal-assisted therapy and nutrition in Alzheimer's disease. So this study examined the influence of animal-assisted therapy, specifically fish aquariums, on nutritional intake in individuals with Alzheimer's disease. 62 individuals who lived in specialized units were studied. They had baseline data obtained and then a 2-week treatment period when the aquariums were introduced. It was collected daily for 2 weeks, then weekly for 6. And they found that nutritional intake increased significantly when the aquariums were introduced and continued to increase during the 6-week weekly follow-up, with weight increasing significantly over a 16-week period. In addition, that participants required less emotional support, resulting in healthcare cost savings. So just the presence of a fish tank in some patients. Now, when you go to Cheddar's or other places, they probably have the fish tank there so you eat a little bit longer and do other things, but they do have purported benefits. We always talk about allergies in animals. the big thing is there is really no truly hypoallergenic cat or dog. There's some that is probably less activating to hyperlinked IgE on mast cells than others. But you get into this whole thing, is the animal being present protective? So you get into this hygiene hypothesis, and then you talk about Th1 protective immunity or Th2, which is the IgE kind of way of life. When you had to put a cytokine to it, it's easy to remember interferon gamma, IL-12 or Th1, IL-4, 5, 6, depending on the immunologist you talk to, maybe 10 or more Th2. Factors that favor that allergic thing would be what we call a Western lifestyle and urban environment, our diet, widespread use of antibiotics, and sensitization to house dust, mites, and cockroaches. Whereas the Th1 is growing up in a more rural setting, and then you have more people around you. People like to throw the cat under the bus, and then this is one of the things that they do. What increases your risk of atopy? There's probably good data that antibiotics, something wrong with your integument, but cats increase your risk of atopic disease. So, whereas dogs tend to decrease it. So when you look at the hygiene hypothesis, there's different things at play there. I don't know if I can get the sound to work here, but there is a video and a lecture on YouTube after the ad plays that helps from the University of California that talks about this hygiene theory. So if you ever have time and want a really succinct and good explanation on that, this lecture that they've tape recorded is good. Because I've went to the Quad AI meetings, and then they'll have these panels to where they have the pros and cons of pet ownership and hygiene hypothesis and different stuff. But this is a good resource to have.
You would not have
and then we can send these slides to anybody that wants them. That way you can kind of see that link. And in it, but they advertise that talk with pet ownership protects us against allergies. So they're starting to come up with ways to come across frightened parents and owners about what happens. A lot of people worry that the pet's going to give you something. Well, if you had to worry about zoonotic stuff, I would think that you would look at the global burden of zoonotic disease and realize that probably the greatest burden falls on areas of the world and livestock than it does for the conventional dog and cat owner in the United States. When you look at what you could contract, you'll see anything from Campylobacter, cat scratch, ringworm, plague, rabies, rat bite, salmonella. So the big thing that we take into consideration is when you have a pet, you should have a vet. The pet needs shots just like humans do. Over 99% of human cases of rabies are caused by dog bites, but it's 100% preventable if the animal's vaccinated. Rabies is more of an issue where you have free-dwelling canine inhabitants that don't have a structure of going to the vet. So that's why outside of Canada, United States, Europe, Australia, you see a lot more light up. Because I know when I was in Ecuador a couple weeks ago, you have random dogs that come and go. They're not necessarily hostile, they're just not going to get routine care. So rabies is preventable more than any kind of worrying about a bat or a skunk. I did have a patient that put a hand in a mole hole, and he wouldn't believe me that moles didn't have rabies until I got somebody on the phone from the CDC who read the website to him. But dogs are the issue. Kids are probably a bigger issue with dogs, and if you have to think about that is, if you're coming from the dog's perspective, if something with a head out of proportion to the rest of its body's coming at you, you probably be a little bit skittish too. So those kids get bit a little bit more frequently because of that. The CDC has help for patients that may live in environments if they have birds, poultry, what to do. You will see the occasional kind of vicious cycle of ringworm or even MRSA that circulates on kind of animals to human, and it comes, and you have to have a hygiene kind of intervention for those people. You do have gourmet pet foods and different things that increase the risk of maybe salmonella acquisition and different things, and people that want exotic animals probably should not have anything in their house while someone is not potty trained or doesn't have the ability to interact successfully with those kind of animals. But if you worry about going overseas, you should worry about the taxi driver, some other things other than a dog. They don't show up as in the yellow book for leading causes of injury or death when U.S. citizens go to other countries. This gets into the whole thing about what happens if your immune system's compromised. There are some kind of just natural fears that a dog that will lick its anus or different things that will interact with an immunocompromised person, what can it do? When you look at those, there are theoretical risks, but it's like going on a cruise ship. If you have some sandy wipes and some different things and good techniques, there's probably a negligible thing, and there's a lot of misconceptions. But the big thing is it may be detrimental to the well-being of the immunocompromised patient to lose a pet. They're already changing their routine. They're already going through a life-changing diagnosis. So if you lose a human and animal bond, and we already talked about that some of these kids confide in the dog more than they do their parent. This goes true when you look at adult literature too. Then you're adding a significant amount of stress to the situation, which could otherwise be not done. There are some kind of things that you'll see. This was a cat that lived in a unit, and then when he came and sat with a patient, he was pretty good at predicting that they would pass away within 24 hours. So a lot of people looked at it as he needed a little black cloak and hood, but it helped people kind of understand, and it helped the staff prepare and kind of notify the family. And then we've been talking a lot about dogs. Dogs are good. Dogs are probably the decreased cardiovascular risk. But what about the crazy cat lady? Did the cat cause the lady to be crazy, or the man, not to be sexist, but what is it with the cat? So when you look at this, the thing that comes into play is toxoplasma. But if you had to look at what causes toxoplasmosis in an immunocompetent host, it's not a cat, it's some pork. But the definitive host where you see toxoplasma going from that tachy or bradyzoite stage into an oocyst stage is in a cat. When I used to attend the Southern Society of Parasitology meetings, Knoxville has a big toxo lab. Some people in Alabama did too. They would do research to show these oocysts can live on the hide of dogs for months. They were very sturdy things. And then I did research with Chagas disease, and we had mice that you either gave a Trypanosoma cruzi and put them at room temperature or hyperthermic conditions, and then the other lab, which was basically one shelf over, did toxoplasma, and those mice were all over the place, jumping around, acting crazy. And if you look at the literature, toxoplasma in murine models causes mice to act in a way that they're more able to be caught by a cat. So the parasite can finish its life cycle. If you give a mouse heart failure and a big spleen, like in Chagas disease, they don't go anywhere. I like my chill mice a lot better than these things. We also gave them selenium and antioxidant diets, and we found that it favored a better prognosis for the host in the T. cruzi, but it helped toxoplasma more than the host. So it's a nice parasite that's found a niche and knows how to do it. When you look at kind of congenital toxoplasmosis and how we do it, we don't really do the same thing that Europe does. We do more of a retroactive kind of thing where they do more of a proactive approach. We always will have on our minds that congenital toxoplasmosis, those zoite stages block the aqueduct of Sylvius, and then the fourth ventricle, you get the hydrocephalus, you get the encephalitis, chorioretinitis, and all that kind of good stuff. You still see toxoplasma come up. This was in CNN just the other week, how a parasite from cat poop can reduce your fear and maybe make you an entrepreneur. That gets into the same thing about it makes mice act more interesting to cats. So you'll see in some of the psych literature about new onset psychosis or schizophrenia and different things, a lot of that's still being played out. But the take home is there might be something to a change in behavior with toxoplasma, but what you can attribute it to, it's still speculative at this point in my conclusion, but it really shouldn't affect you from getting a cat or not. These things have teeth. They like to, use teeth to masticate and eat. They will occasionally use them on people. So if you had to think about it, kids are more likely to be bitten, and boys 5 to 9 are the age group bitten the most. And then if you chain a dog, they're about 3 times more likely to bite than just having them be more free roaming. So some of it goes into kind of conditions that the animal lives in and those kinds of things. Cats bite too, and unlike dogs where you have to assess where the wound is, the severity and different things, most cat bites suggest an antibiotic prescription. Augmentin is the one that comes to my mind most of the time, so they do bite. But if you notice too, like we've desensitized to human violence, but if you ever watch a movie, you're like, don't kill the dog. So a lot of people play on our emotions and our interactions with dogs. But what happens when we start to abuse the dog? So there is a link between child abuse, elder abuse, domestic violence, and animal abuse. And then this is a graphic from DA Association about recognizing what animal abuse can do. It does present a risk of child abuse. It may predict future violence. It is used to threaten human victims, and it's used to prevent families from leaving an abusive home. And the co-occurrence of multiple forms of violence increases future violence. And if you look at it, it's important to recognize this because the data in 2014 that this criminal professional group used says that we have more kids in this country that live at home with a dog than with a dad. So using the animal as a predictor of their abuse risk can be helpful. So that's our whirlwind kind of adventure into animals. I wanted to stop with about 10 minutes left if anybody had any questions. And thanks for being patient with me and coming this morning. And that's the whole brood of animals that I've had over the last 10 years. They're not always that cute, though. Well, if anybody doesn't have any questions, then y'all can enjoy the morning. Oops.